everyone, welcome to Suman TV. I'm Shrujna. Today we are with Dr. Sai Kalyan, who is specialized in neurosurgeon and works in KIMS Hospital. And also, let's meet the chairperson of Neurobrain and Spine Clinic. What are you waiting for? Let's talk to him and clear all our doubts. Hello, sir.
Hello.
How are you today?
I'm good. How are you?
I'm so good. Thanks for asking. So, doctor, what is cervical spondylosis and when to seek a doctor's help?
See, basically, cervical spondylosis is a condition where there is wear and tear in the joints, and it's to put it very simple, we call it as arthritis of the joints. And because of this arthritis of the joint, there is wear and tear, and this wear and tear, because of this wear and tear, there is compression over the cord, or compression over the nerve, or compression of the both.
Okay.
So because of this, the patient will develop symptoms like neck pain, neck radicular pain. I mean, the pain gets radiated to any part of the upper limbs or lower limbs, like that, and it can be a combination of both.
So, doctor, also please help us to understand what are the causes behind it, and also to understand the treatment.
Okay. See, basically, this cervical spondylosis, generally the patients, as I said earlier, the patients present with neck pain, and they will be having this radicular pain. That's a shooting type of pain, which gets radiated from neck to upper limbs, both the upper limbs or a single upper limb. It's like that. And the causes of cervical spondylosis are, or to put it very simple, neck pain. Neck pain causes are, it can be because of muscle sprain or muscle strain, or it can be because of a simple disc disease, as which we see in young people, where they have a severe pain which will be radiating to one of the limbs. And it can be because of compression of the cord. So because of compression of the cord, the patient will have tingling sensation, numbness sensations, pain, and difficulty in walking, and all these things.
So, doctor, how to evaluate this neck pain?
See, initially the patient need to consult a doctor, and there will be a set of clinical examination followed by radiological examinations. In clinical examination, doctor tries to find out the symptoms of the patient, like neck pain, radicular pain, and all these things. And there are some set of neurological examination which a doctor performs on the patient. And if he feels that there are any deficits, like if there are any weakness or tingling numbness, or if the pain is intense, then he'll ask for X-ray and followed by MRI based upon the clinical examination. And these X-rays and MRIs and other tests called as NCS, we call it as NCS, nerve conduction studies, will give a clue, and we can diagnose what exactly is going on in the spine. And coming to the treatment part, see, based on the diagnosis, there is the treatment level. See, based on the diagnosis, there is a specific treatment. So for example, if it is a mechanical sprain and strain, so nothing has to be done. The rest followed by pain medication and physiotherapy with ice compression or heat compression or IFT, that will help. Whether it is a disc disease, we need to classify whether it is it requires surgery or it can be managed medically. So once, as I said earlier, the medical management fails, then if there are any deficits, then we have to go and do a surgery.
Right.
And some cases are specific for surgery, like they have absolute indication for surgery. In that aspect, we need to go and address that issue.
Okay.
To get the pain relief and to relieve the compression over the nerve or over the cord.
Okay, so what are those indications which ask for the mandatory operations or surgery?
Yeah. See, for example, a disc prolapse, prolapse disc, which is causing weakness of a particular, which causes weakness of hand or legs or whatever. In those cases, one needs surgery. Okay, one requires surgery. So there are again options, different options. Generally, we perform a microsurgery. We remove the disc, and the disc will be replaced by an artificial disc or any spacers. And we infuse the segment, followed by proper rehabilitation, proper neuro rehabilitation. There is a specific neuro rehab protocol for that. So which will be advised to the patient, so that they are going to be pain free, and they are going to get back to their work very within maybe around 15 to 20 days.
And also, is it safe?
Yeah, it is safe. But yeah, of course, there are some complications related to surgery. Surgery itself may cause some complications. There are different complications, but the complication in expert hands, and it can be around 1 to 2%.
So, doctor, thanks to pandemic, that work from home fashion is on the track. People nowadays are working from home. That means constantly in front of system. With addition to work from home, there are a lot of complaints, which also includes neck ache radiating all the way to the shoulders, and also backache. What could be the reasons behind it?
When a person sits in front of a computer, a system, main thing which they forget is the posture. The posture constitutes a very important thing. It's a very important thing, and unfortunately, even we don't concentrate upon our postures.
Yes.
So, the improper posture and prolonged immobilization for a long time in front of system. We keep sitting in front of system for a long time, and knowingly or unknowingly, we'll be tilting our heads like this
Yes.
way, and because of the stress, all these things. So ideally, the patient starts developing these neck pains. So first, immobilization is a stress, automatically psychological stress. See, they'll be having some targets. We need to fix this problem. We need to
Exactly.
finish off this and
So
finish off these
maintaining
things.
the production time.
Yeah, so we forget this, and improper hydration in between. All these things, it constitutes for this neck pains,
Okay.
and it causes basically the strain and sprain of the muscles.
So what are the precautions that can be taken from the work from home people or the IT company people?
People who spend
Most
lot
of
of
the
time in front of systems should be aware that in between they need to get up, have a stretching of the neck, and proper hydration is very necessary. They have to be focused, and they have to be aware of their posture, because correction of the posture itself reduces many problems like neck pain, low back pain, and all these things. So in between, if they are feeling stressed out, it's better to take rest, come back, and again work. And stretching exercises with muscle strengthening exercises, it really helps. And a proper exercise daily. So person should be fit. So if you're fit, the chances of landing up into these complications, these
Okay.
diseases are very, very less.
Right.
So I would suggest them to concentrate mainly on the posture, the isotonic exercises, isometric exercises. This will be helpful, and with good amount of sleep
Okay.
and adequate hydration.
So talking about the postures, what kind of postures that one should practice, whether they sit or stand, even they walk?
Yeah. See, posture constitutes an important thing. Okay. See, ideally, the nature has given a proper alignment to the spine. So if you can maintain the alignment of the spine in the cervical, that is the neck, thoracic, that is the we call it as upper back, and
Okay.
lower back, that is the lumbar spine. If you maintain this alignment, then that's well and good. And there are some precautions to be taken. Suppose we see some people, they'll be carrying phone in one hand, and they'll be just shrugging the ear to the shoulder, and
Yes.
so these practices are supposed to be avoided. And as I said earlier, the stretching exercises and strengthening exercises of the neck will definitely helps to relieve all these things. And when something falls down, so one need to be careful, to lift it.
Okay.
They should follow. There are some movements that have to be followed exactly. It's not like just something fell down and you're going to go and pick it up.
Okay.
So we need to bend slowly and pick it up. So all these things a physical therapist can help us out, in maintaining these postures. And if something, if the person is, the person has got work like bending forward and picking, lifting the weights, and all these things, have to be taken care.
So doctor, what are the protocol treatments that you follow when spine related problems patients come to you?
Yeah. See, basically it has to be classified into two things. One is the medical management, other is the surgical management. So the medical management, as I said earlier, for pain we need to be generous in giving the painkillers. We need to give neuropathic pain. I mean, we have some of the set of medication which relieves the neuropathic pain. And nutrition is another thing. Most of the times we neglect it, because nowadays we are seeing in our practice, day-to-day practice, that many of the patients who come to us are having vitamin D and vitamin B12 deficiencies.
Correct.
So that has to be addressed. And other things like nutrition, all these things have to be taken care. If you come to Physiotherapy. See, what we do is the patient is having severe pain. So we ask them to take rest, absolute bed rest for 3 days, following which we recommend them to start the isometric and isotonic exercises slowly. It's not like doing hours together. So the graph has to go up slowly, very slowly, under supervision of a physical therapist. Because what happens is once the pain is relieved, we start doing vigorously, and again that pain again hurts us. So it has to be done gradually. Once these exercises are done gradually, slowly we'll get relief from pain and we can be back to work as early as possible. And other things like, as I said, medication will definitely help. And if all these things fail, again, we reevaluate the patient, whether he requires surgery or not. If it is indication for surgery, then obviously we need to do the surgery.
They should go on.
They should go for surgery. And some of the indications are sure shot for surgery. And in those patients also we explain them. See, these are the things which have happened, and that is the reason why you require surgery. And of course, some patients, they say that, sir, we want to opt for medical management, and we'll see. And if it doesn't come down, then we are going to go for surgery. So in those patients also we recommend the same thing. We ask them to use a collar. We ask them to take bed rest, and we put them on some painkillers, medications, and we'll reevaluate. And some of the patients may improve, and some of the patients may deteriorate. And obviously, who deteriorate, you're supposed to go and do the surgery.
So doctor, how to prevent the neck pain and back pain while riding vehicles or even a bike?
As I said earlier, the posture. The posture is an important thing which one needs to have in their mind. And suppose if the person is planning to travel for a long ride, so it's better they take breaks in between and at least 1-2 minutes of stretching of neck muscles, and then again going back. And it's not advisable to drive a bike in the roads which are having ups and downs, that's bumpy roads, where there is a lot of mechanical trauma on the spine. So those things have to be avoided, because you'll be wearing the helmet, additional weight, and going on the roads which are having the bumps. It's better not to
choose that way.
Choose the way, and it's not advisable.
Yeah, and actually, also to avoid the long journeys can also be helpful.
Yeah, that will be helpful. So I personally say to avoid long drives and bikes.
So what are the treatments that are involved when the treatment goes for low back?
Yeah, see, again, the low back evaluation has to be done both clinically, and the patient comes to a clinician. We have a set of clinical examination which we are supposed to do. And based on that, we ask for radiological, either it's an X-ray or MRI, based on how severe the problems are. And based on that, again, it's classified as medical and surgical management. In medical management, generally we ask them, to do the back strengthening exercises, back protecting maneuvers. And ideally, we ask them to start with simple aerobic exercises. Once the pain is relieved, we ask them to start with simple aerobic exercises, along with walking, and swimming is an ideal exercise.
Yes.
In order to avoid pressure on the low back. So after this, we slowly ask them to start the muscle strengthening exercise of the low back, core strengthening, and all these things. So this has to be done gradually again. And definitely they'll be having they'll be having pain relief. And if not, again we are going to reevaluate. And some cases are sure shot for surgery. Yes. So there is no other option, but we need to go and fix that problem.
Right.
Maybe like you have heard about the disc prolapse, disc extrusions, and all these things. Because one has to remember that the disc, whichever is there, has come out and it is compressing the nerve root. So we need to remove that compression. So it has to be decompressed. So, and early the decompression, early the chances of improvement neurologically. That's what we advise.
So as you have already mentioned about swimming and walking are good habits to build. So how frequently that one can actually swim or even walk?
They say that ideally 5 hours a week is helpful. 5 hours a week.
So most of the people are actually scared to undergo this spine surgery because thinking about the side effects which may or may not be there. Give the brief explanation about it.
Yeah, definitely it is there that people are scary to undergo spine surgery because they have a belief that after undergoing spine surgeries you're going to become paralyzed and all these things. But with the advent of these new technologies, like we use high-end microscopes, we use high-end drills. So the chances in an expert hands, the risk is less than 1%, I would say, in my practice, in my 9 years of practice of neurosurgery. I don't say that the complications didn't occur, they do happen, but the complication rate is less than 1%. So, as you know, we are dealing with many spine cases. We often, assure the patient that they are going to come out, clinically. I mean, they are going to come out well, and they are going to get back to their work within maybe around 2 to 3 weeks.
Also help us to understand, will they be able to walk being independent and without even the support of a walker? Can they be independent?
Yeah, of course. See, if it's a simple disc surgery, as what we do is a micro discectomies, and we make the patient walk in the evening itself, and we'll be discharging the patient next day, and we advise them to go back to their work based on their pain tolerability, maybe within 2 weeks. And we have done a major surgery like spine fixations. So in those cases, we ask the patient we make the patient to walk the next day, and we advise them some of the precautions to be taken. And generally, all our patients within 1 month they are back to their work.
Okay.
So it's not like taking rest for days together.
Okay.
So early the ambulation, then the outcome is good.
So it's only 1 month they are going to take rest.
Yeah, and not even 1 month. I mean, they're going to take rest for only a couple of days.
Right.
And after 7 days and 8 days, we are going to remove the sutures, and we are going to direct them to the physiotherapy department. And there is a protocol which they follow. The back strengthening exercises and the back protecting
for the
maneuvers.
Flexibility also.
Yeah, all these things, stretchings and muscle strengthening exercises. And once, depending upon their pain tolerability, they will be back to work. And most of the patients are patients, which we have operated, which I have operated.
Okay.
They're going back to their work within 3 weeks of time.
Oh, that's the good news.
2 to 3 weeks maximum.
Right.
We need to create awareness in patients. We need to explain them what is the management plan which we are going to do along with the complications, and I feel that is the key. See, most of the patients, they'll be having apprehension regarding the spine surgeries, and if we explain them in proper manner with the complications and all these things, definitely the outcomes are good. Because when you're not going to operate on a specific indicated case, then the damage would be more. So that's the reason we need to explain the risks and benefits.
Okay.
And then further we need to operate the patient upon.
So since Google has all the answers when it comes to spine surgery, how frequently or how much they can rely on the search engines?
See, I personally feel that Google is one should have a complete knowledge or shouldn't have knowledge. Having knowledge in between is anytime dangerous.
Okay.
So it's better to consult a doctor as well.
Right.
See, because each and every subject is a different entity. So the problems which you have, I may not have, and the way I present with a low backache, the other person doesn't have. So it's ideal to consult a doctor, get a proper evaluation done, and then go for surgery or medical management.
So thank you so much for your valuable time, sir,
Thank you.
also
Thank you so
explaining upon the major aspects here.
Yeah, thank you so much.
For any consultations or queries, feel free to contact to the below numbers which are scrolling down in the video. Thank you so much for watching this video.